This is an Evergreen Media Network studio production.
Hi, welcome to the Preventus podcast, everybody. We talk about all things health, well-being with a focus on prevention and longevity. I'm your host, Dr. Felice Haake. I am missing my co-host, my usual co-host, Dr. Brett Haake, because we're in a series about aesthetics with my special guest, Melissa Meadows, who is a nurse practitioner that does focus on aesthetics in our office, and I am so blessed to work with every day.
Thank you so much for having me again. I'm really excited to be here.
I'm so excited by this. The first series, we really kind of dived into really just kind of the overall in aesthetics. And we did a little more of a focus on botox and a little brush into fillers. But this one, we're going to get into a deeper understanding of fillers. So if you could, just for those who might have missed our first episode, could you just walk us through some of what we discussed?
Yeah, absolutely. So our first episode, we really distinguished the difference between what would be your neuromodulator versus your filler product. And as I had previously mentioned, your Botox, which is the neurotoxin that kind of reduces muscle contraction, that just helps with those expression lines. And then we take it a step further with a different injectable called filler. And that is an incredible transformative medical treatment that helps revolumize the face. So I thought it was really important because filler is such an interesting product because it's so extremely versatile that I thought it would be important to take a second episode and kind of dive a little bit deeper and go a little bit further to help our viewers kind of understand the reason why we inject filler and how it could really benefit them.
Okay, so we're going to be talking today mainly about the types of fillers, some trends, some of the newer, latest things that you can do with fillers, because I'm not sure everybody understands what they can actually do with fillers. And then some of the safety, aspects of fillers, because it's not always a walk in the park. You have to be aware that there are, possible safety things that, can happen, detriment.
So I'll talk a little bit about the difference of fillers, some of the nuances and techniques, the different areas of the body that we can put it. And then I'll definitely talk pre and post care and then some of the normal side effects with filler. So let's kind of just dive in. The different types of fillers, you've got your hyaluronic acids, in which I mentioned previously. Those are your Juvederms, your Bellateros, your Restylans. They do a beautiful job of filling a space. And of course, a hyaluronic acid is what we call a hydrophilic product. So it's really going to hydrate the tissue as it draws in water. So if we can go ahead and put up that first before and after, you can see the before and after of a lip augmentation. And hyaluronic acid is something that we put in the lip or underneath the eyes. It does a beautiful job of just volumizing that area. And since it's soft tissue, you want to use something that's really soft and supple. So as you can see in this before and after, this was actually Juvederm Ultra. And then moving forward, thanks, Jesse. Moving forward, when we talk about other fillers, we've got biostimulatory fillers, and those are your Sculptras and your Radiesse. I had mentioned previously that Sculptra is your polylactic acid. It drives endogenous collagen and does a really beautiful job of volumizing the face and providing skin remodeling.
Right.
And then there's an additional product called Radiesse, which is calcium hydroxyl apatite. Not only does that drive endogenous collagen, but it also stimulates elastin. And I've got a beautiful before and after of this patient. This is the anterior view. On the left side, you can see her before.
Wow.
And then on her after, you can see the right. And I actually use 5 syringes of Radiesse on this patient.
It really balances her face.
Completely.
For those who are just listening to us on the radio or, Apple Podcasts, you can subscribe or go on our YouTube channel, the Preventus podcast, and you'll be able to really appreciate these pictures. I'm just blown away by this one because the patient's entire face, and it actually makes her way more youthful. I mean, she already looks pretty young, but just takes on a different balance to her face by the filler in the chin, etc.
Yeah, typically these patients come in and they just say, you know, I'm having a lot of lower facial laxity. And then I educate them on why this is happening. And a lot of the times it's due to bone recession. So that mandible actually starts receding.
Oh.
And then gravity pulls down that excess skin that doesn't have that foundation of that skeletal frame. So if we could see in the next photo from that side profile, what I did here is I gave her a chin augmentation and then place that radius, which of course I chose calcium because nothing mimics bone better than calcium. So I placed it along her jawline, and she just has a greater depth of her mandible, and her profile view is much stronger. So
is this after photo directly after doing? That's amazing.
Directly immediately after. And if we look at that interior view again, you can actually see some of the redness along the chin. So you can see immediately after treatment, she's got a little bit of swelling, some redness to the tissue. And further in the podcast, I'll go over some of the normal side effects and then some other things that can happen. But moving on to the next picture, when you see her from the lateral view, I also, what's really awesome about this product too, and why I get so excited about filler, is a lot of the nuances and technique is you can actually dilute the product and you can create skin tightening effects. Since it drives collagen and elastin, which is that thickness and that retraction of the skin, you can dilute the product, and you see a lot of providers doing this, whether it's Sculptra that they're using or Radius. And they're actually putting it in soft tissue, whether it's temple, submalar area, neck, abdomen. And I'm going to show you a few other photos and other areas where we take this product off label and really drive skin remodeling and really euthanize the body.
Yeah. So how long can, I know this is always a question because it can be expensive. How long can someone expect for these results to last?
Yeah, that's a great question, you know, and it's very individual per patient. And I always say, you know, it's based on your lifestyle as well. There's things that you can do to mitigate, you know, your aging process, your sun exposure, staying well hydrated, eating healthy, exercising, building muscle mass really keeps your skin taut and in shape. So there's little things you can do there to help and create, you know, a longer result, essentially. But what I love so much about these regenerative products is how I explain it to the patient is I'm resetting your age, basically.
Yeah.
I always describe, I use the analogy, it's like taking I-95 north, right? Okay, the left lane, you're going 100 miles per hour, right? On the right side, okay, if you want to slow down, that's me, that's you coming to see me. I'll get you there. We're all aging. We're all going to get off at the same exit, but I'm going to take you a little bit slower. Yeah.
I love that analogy because it's so true. And as far as the length is concerned, I might have mentioned this on the prior podcast that, you know, I had my nasolabial folds done. I mean, it's had to be 7 years ago. I've really never had to do them again until very, very recently. And I'm not even sure I really needed the same amount that I did 7 years ago. So there is kind of a restructuring, a rebuilding, almost like a scaffold under the skin, correct?
Absolutely. Whether it's hyaluronic acid, which is that injection process and the stretching of the tissue that can build collagen, or actually using a biostimulator such as Sculptra or Radius to drive that collagen or elastin. Absolutely. Looking at other techniques as well. So these products, when we talk about diluting them, we can put them in other areas of the body. And there's a beautiful study done. It was actually the Brazilian consensus paper on recommendations on how to use dilute Radius in the body. It was published in 2019, and it's got a beautiful before and after of a gentleman and an 8-week transformation.
Oh my gosh.
And you can see the transformation. I mean, look at that subdermal tissue just thickening and tightening. I mean, he looks much healthier. So when you look at these products like Sculptra and Radius, there is FDA approval that it improves, skin remodeling, a thickening of the tissue. And it's actually indicated in a lot of patients. I mean, Radius came back in 2006. It was FDA approved, and it was first indicated for patients that suffered from lipoatrophy due to HIV.
Yeah.
So they were getting a lot of, and to our viewers, lipoatrophy is just a reduction of fat, whether it's in the face or other body areas.
And you get like a gaunt look.
Super gaunt,
Yeah.
and they look very, very sickly. And these patients are hard to treat aesthetically. You just can't put a thick filler in like a soft tissue part of the submalar. And by submalar, I mean that area that extends below the cheek to the mandible.
Yeah.
You know, putting a thick filler there, they'll look great at rest, but once they start animating, talking, chewing, you're going to see some lumpy bumpiness.
Right.
So it doesn't look very natural. If you dilute the product, you create a nice wash into the tissue, and it just is very fluid, and it moves with tissue as they express themselves. And as you can see in that patient, over the course of 2 months, their body starts building endogenous collagen, and they just look healthier, less gaunt.
How old is that patient? Do you know?
You know, that I don't know.
He looks like he's like low, like 30s, right?
Potentially. Yeah. I mean, it has the ability to take you back 5 to 10 years just by making you look more supple.
That's really amazing.
The other thing is, I mean, we can pull it away from the face and inject it into other areas of the body. I believe the next picture that we might have, that's arms rejuvenation. I mean, you can take Radius, you can dilute it and inject it using a cannula, not even using needle. You just use what's called a blunt instrument.
Yeah.
And you just thread it through the tissue so it creates a nice wash. You massage it in, and over time you see the actual tissue look less crepey. So it's a really beautiful product.
Yeah, because for the listeners who can't see it or who aren't watching our YouTube, it's a picture of a woman's arm, and basically it's very crepey. It's kind of that crepey skin when you have your arm kind of close, hugged against your body. I don't have anything like that. Just kidding.
I call them the little bat wings when we go. Usually I see mine when I'm putting pepper on anything.
When I'm working out and I look over and see that, I'm like, oh, there it is.
Yes.
It's just a reminder of aging, but I'm looking at this and I'm like, oh, I think I'm going to have this next because this is really impressive. Can people do that around their knees? That's a big complaint as well.
So this study, I mean, where that picture is credited from, I mean, it shows other areas of the body, such as knees, thighs, the abdomen being treated. And, you know, with any skin tightening, it is typically a series of treatments to optimize correction there. Okay. So a lot of these patients befores and afters that you're seeing are multiple treatments spaced out over 4 to 6 weeks. So that's why it's incredible to set up a good consultation with a certified professional that will, you know, basically take your aesthetic goals and tell you what it's going to take, how many syringes, how many series of treatments to get you to goal.
Right. You need realistic expectations for everything as well. I totally agree.
I actually have another really cool picture that is of hand rejuvenation.
Jeez,
So back in 2015, it was FDA approved for Radius to be injected within the hand. On the left side here, you can see how we get a thinning of that.
Yes, I have this hand on the left.
That skin there. And you can see just after one syringe, one treatment, you can see the level of correction. I actually have it placed in my hands. I mean, I have it all throughout my body.
My gosh, that's amazing. So do you know the story with my daughter Ryan?
No.
Okay, so for the listeners who don't know, I have 3 children. I have a 17-year-old, an almost 16-year-old, so a 17-year-old girl, 16-year-old boy, and then we had kind of a late in life baby.
No,
and she is 7. Well, she's very aware that I'm older than a lot of her friends' mothers. And when we go to her school or I do anything at function at her school, she started kind of getting obsessed with my hands to the point she'd say, I'll need you to hide your hands. Oh, no. When you're near my friends and their parents. And I was like, Ryan,
Kids are so
gosh.
honest.
So now I'm looking at that hand, the beforehand. I'm like, that's my hand. So your face can look young, you know, all these things. But like areas of the body that I will like look at just as a physician and kind of be able to tell someone's age, I look at necks a lot, and I look at hands a lot. Yeah.
We always apply everything to our face, whether it's sunblock or anti-aging serums, and we really negate our neck, and then our hands get so much sun exposure even while driving. So it's just, it naturally degrades over time. But we've got these beautiful products just to kind of rejuvenate. And not only do I like to use filler there, then I'll slap a peel on it and I'll help just kind of clean up some of the pigmentation. So you just look, a lot healthier.
Right.
Yeah. It's lots of exciting things. So the other thing I always like to mention is just how to better educate a patient on pre and post care when we talk about these injectables. I mean, I always tell patients it's really important to time your treatments according to major events.
Yes.
You definitely want, any time prior to getting filler, you definitely want a minimum of like 2 to 4 weeks prior to any major event, because there are some side effects that do happen. I mean, the most common, some swelling, potential bruising, tenderness to touch, things like that. And you don't want that in your wedding photo. So I always say, give me a little bit of time before we treat,
So seriously though, if someone were getting married and they were like, I want to, plump up my lips a little bit, do a little something here, you would recommend 4 weeks or 5 weeks before?
Absolutely. Yeah. I think lips, jawline, cheeks, everything looks best in my book at 4 weeks. Typically swelling goes down within about 72 hours. I say max 2 weeks.
Yes.
But you definitely want to allow time for your body to heal. And there's other things that patients can do to kind of prep themselves for day of injection. I usually recommend arnica, which just is a plant extract to help minimize bruising and inflammation. So they can take that orally or apply it topically after treatment. If patients, which a lot of your patients are on supplements, if they're taking omega-3s, if they're eating garlic, turmeric, vitamin E supplements, things like that can thin your blood and increase the risk of bruising. Also, are they taking a daily aspirin? Of course, you want to speak with your primary care provider before you discontinue any blood thinners or anything like that. But you can kind of prep your body to minimize those normal side effects.
Absolutely. I learned the hard way about that.
We all do.
The first time I ever did anything, I didn't stop my fish oil. I had alcohol the night before. Those are all things that will increase, and increase your chances of bruising. And I didn't do any of the, prep, taking arnica like a week or two in advance. Or there's another supplement we've talked about before, bromelain, quercetin. That's phenomenal for reducing bruising. And so my first experience was bruising, and it was in my mouth, and it dropped down. The gravity kind of pulled it, so I had a bruise on my chin.
That kind of comes down to the chin. Yeah, that's happened before.
And then the second time I said, my girlfriend of mine said, oh, you have to prep better. And so I did, and I had 0 bruising. So there's an ability to at least minimize it. I can't say make it 0, but minimize the bruising.
And I will tell you, lips are extremely vascular. So is around the eyes. So those areas, there are areas of the face that are more prone to bruising than others, you know? So you can kind of anticipate that. Applying ice after treatment too will shunt the blood to the area, reduce potential bruising. What else could I tell you?
Well, I can tell you people are often, and I was, very afraid of the pain associated. And I can speak to it on a personal level, as I know you can. The pain in terms of doing jawline or submalar temples was minimal. The first, because you use a blunt. Injection device.
There are 2 ways to inject. You can either use needle or cannula technique. And cannula is just, appears to be like a long straw-like tube, and it's a blunt instrument, so it does a beautiful job of reducing the potential to bruising your patient.
Yeah, it's wonderful because that instrumentation, you actually have to use like a little, almost like a peg to make a hole in the skin. That's the only part that really hurts, and then the cannula goes in and you're filling, and everyone watching it, their eyes are wide because it looks kind of crazy, but it doesn't hurt at all. Now, I cannot say the same for lips. That is a little spicy, but you get through it. And I think everybody has different pain thresholds as well.
Absolutely. Everybody has a different level of sensitivity. And I will tell you, lips, that is my pain scale. It's 0 to lips, how does it feel? We used to say in nursing school 1 to 10, 10 being the highest amount of pain. How do you feel? My pain scale is 0 to lips. Because, I mean, think about it. It's what we kiss with. It's the most sensitive area on the face, you know? So with that said, there are ways to make it more comfortable for a patient. So you could use something as simple as just topical 23-7. BLT, benzocaine, lidocaine, tetracaine mix. You can do nerve blocks to really desensitize the area. You know, so there's many different options. We even carry Pronox in our clinic, which is nitrous oxide and oxygen. It's laughing gas. The patient inhales that. It's out of their system. Max 10 minutes. They're able to drive themselves home. So there's lots of ways that we can mitigate that. The other thing, though, in getting back to talking about the main side effect of potential bruising for the lip, we have the Aerolase, which is a beautiful laser that targets the chromophore of hemoglobin. So anytime I see it pop up after immediate injection, or even I follow up with a patient the next day and they have a little bit of a bruise, I just bring them in, I zap that, I apply some arnica, and I try and get them through the process a little bit faster.
Yeah, it really accelerates the healing process, doesn't it? Yeah. So other safety concerns, like what are things, I mean, I've done this many times. I'm now not afraid of it because I've had good experiences every time. The worst I've ever really had is a little swelling, mild swelling, and bruising. But what are some of the potential side effects that, you know, you as a practitioner are really weary of?
So I'm really glad that you brought this up, because actually yesterday in clinic I had a patient come in and I've already worked with her on skin tightening. We started with the least invasive correction. So we started with all therapy. You know, she first presented, I'm seeing some signs of aging, lower laxity in the face. So we started with something that she was comfortable with, which was just skin tightening. Then we moved on to a little bit of Botox. She saw the benefit of that. Okay. And now she came in yesterday for her Botox follow-up and said, you know what, Melissa, I think I'm ready to do a little bit of filler. And I said, oh my God, I'm so excited. This made my day. So her main reservation was, she said, I have Googled, and good Lord, I am terrified. Well, it is my job to provide her with the appropriate information. And yes, even though this is an elective procedure, it is not without risk. It is still a medical treatment. Okay, so we've mentioned some of the main side effects being bruising, tenderness to touch, inflammation, and boost of confidence, you know, but there are some more serious complications that, though rare, can happen. And when I was a trainer, I would always tell my trainees, it's not if, it's when. When you're seeing enough patients and injecting enough, especially high-risk areas and an advanced technique, you do run into some complications potentially. But that's why you go to a licensed professional. They should have protocols in place. So most rare but serious complications would be either a vascular occlusion or compression of a vessel, which is very serious. That impedes blood flow to the tissue and it can become necrotic. So what your provider will do anytime I'm assessing a patient or even working with a patient for the first time, and I'll real quickly say this because it's very important, on consultation, when they're signing that consent, you've got to go through the normal side effects and the most serious. And I tell them, if I'm injecting you and I see your tissue presenting, whether it's looking a little blanched, I may intervene with either a warm compress, a vasodilator topical, or actually break down the enzyme with or the product with an enzyme called hyaluronidase to kind of just reinfuse that blood flow. You know? But it's important to establish that initially and let them know that there are more serious complications. And once you get through that and you tell the patient that I'll walk you through this process, they usually feel more comfortable. And, you know, we have a little bit of time remaining, and this is in a series, so we will have more. I promise. And eventually we'll let Dr. Brett come back. He's
like, when can I come again? I'm like, no, you just stay out of this. But how about just some of the myths? Can we debunk some of the myths? I mean, I will tell you, people are petrified. I'm going to have duck lips.
Yeah.
I'm going to look.
Good filler is undetectable.
Yeah.
It really is. It's a woman's best kept secret.
Yep. So, because that picture, I mean, Jesse just put back up of this woman's lips. I mean, it is absolutely, it looks like they were just natural to her face always. It just fit her face. The thing that didn't fit was her thinner lips before, you know, so it's really, really remarkable. So I think just kind of for, you know, the sake of time and us kind of wrapping things up, this was a very good introduction to filler. I know there are a lot of people who are very frightened of it. They're frightened of a lot of aesthetic things. And that's what I'm trying to do here. And I think you are as well, to kind of.
It's just demystify everything.
Exactly. And then on our next podcast, we're going to do another series, and we're going to kind of hit up on some of the body treatments that can be done, some of the laser treatments, which I know a lot of our listeners want to hear about.
Endless.
Yeah, so thank you very much for joining me. This is the Preventus podcast, and have a great day.
Yes.